Welcome to Chatting with UPOH. I'm your host for this evening, Carolyn Mayo, Managing Partner of United Providers of Health. United Providers of Health is an independent providers association assisting with addressing the social determinants of health for rural and underserved areas. Today, we have Michelle Ivy, who's the Chief Program Officer for Daymark Recovery Services. Welcome to the show, Michelle.
Thank you so much for having me.
You're welcome. Daymark Recovery Services is a huge organization serving Central and Western North Carolina. Let's just talk about the number of people that you serve each year. 50,000 people that you're serving each year.
Yes.
44 locations, 30 different counties that you're in out of the 96 for North Carolina. It's huge.
We're a very large agency, and we're a nonprofit agency. We provide a large service array focusing on everything from individual and group therapy to medication-assisted treatment, psychiatric appointments. We have enhanced services such as assertive community treatment team. We have tailored care management. We also have mobile crisis. We have 5 behavioral health urgent cares. We have facility-based crisis centers for adults and children. And our service array seems to grow some every year, depending on the need in each community. But we serve the mountain counties, Watauga, Avery, Ashe, all the way to Vance County, down into Mecklenburg County, and then down into the geographic area known as the Sandhills of North Carolina. So we have services in all those locations. Our basic service that we offer almost everywhere is our walk-in centers. So a person, adult or child, can walk in and receive a comprehensive clinical assessment, and from there we make treatment recommendations for that person and help engage them in that service. Our folks never receive a bill. There may be, for individuals that may not have insurance or have private insurance, there may be a small copay, but we never refuse to see someone that walks through our doors. The vast majority of the people that we serve meet the federal guidelines for poverty. We do attempt to help individuals enroll in Medicaid with Medicaid expansion. That's been a great gift to the state.
Absolutely.
And so it helps us address social determinants of health and just a number of things that individuals need.
So you mentioned the behavioral urgent care clinics. That's new, relatively
yes.
new to the state of North Carolina.
Yes.
Let's go into that just a little bit and talk about what's the difference between a behavioral health urgent care clinic versus the walk-in services that you are providing on a day-to-day basis.
So our walk-in centers, our advanced access, are open Monday through Friday, 8 to 5. Our behavioral health urgent cares are open 24/7, 365, 3 o'clock on Christmas morning. So there's always someone there, and a person can walk in and say, I just need respite. I've had a crisis at home. There was an altercation between me and my brother, or whatever the case is, and that person can come in and stay for a number of hours.
Adult or child?
If a child comes, they have to have their parent or guardian with them.
Okay.
But adult or child can be served. They come in, they have a physical health screening. We take their blood pressure. We take their finger stick blood sugar. They see a clinician for a comprehensive clinical assessment. And then from there, we make a plan. We do a crisis plan. And then we say, okay, yes, this person needs detox, and that's what they're asking for. Or this person just needs a break from their environment, and they need some crisis planning. And so we can provide that and then have that person follow up with an outpatient provider or the provider that they may already be engaged with. So the behavioral health urgent care offers a good option for a large number of people, depending on their situation, whether it's they need detox services or they need to follow up with mental health treatment. You know, a lot of times we find people have complex social determinants of health, and that's why they're coming to the behavioral health urgent care. We can then link them to care management. We can provide them with resources. We can provide them with clothing, give them something to eat, take a shower. We wash their clothes. These are all things that we do to help.
Washing clothes.
Yes, we wash their clothes.
Just basic needs.
Basic needs. And that helps a person feel cared for. And I've had somebody say to me, well, I come here because I know you'll be nice to me.
Oh, goodness.
And so we have people that are so mistreated by the world, and they just need someone to talk to.
So we've heard of the emergency room. We haven't heard of the behavioral health urgent clinic. There are beds there.
There are not beds there. There are recliners, and you can stay up to 23 hours under the state service definition. So a person can stay 23 hours. but it's not a place for a person to use as a shelter, so to
Right.
speak. Although we do serve individuals who are experiencing homelessness.
Right.
But it allows that person to get a good crisis plan in place and move forward from there.
So regrouping,
Yes.
resetting. Let me send you on your way
Right.
and give you a plan. And in addition to that, Daymark offers the clinical services
Yes.
on a day-to-day outpatient
Correct.
service.
And it may be that a person needs something like assertive community treatment team, but they've been difficult to engage, and that's the nature of their mental health issue. So a person who has schizophrenia, they're going to have a hard time a lot of times understanding what they need. And so if they can engage with the behavioral health urgent care, you'll hear it called a BHUC, then we can help link that person, establish trust with that person, and get them involved in services. And it may take us 3 months of seeing that person every other week or every third week, but we establish that relationship and try to get that person engaged.
This is so needed in central and western counties of North Carolina, which is typically the rural areas of North Carolina. It's not the Raleigh, it's not a Charlotte, but even though you do have locations in Mecklenburg, it's still outside of the norm where you typically don't see this type of access.
Right.
What was the strategy in going to the rural areas of North Carolina?
So I think the strategy was looking at where are the services needed? Where is there a desert of service providers? So yes, we have telehealth and that's very helpful, but sometimes we need a place to go, not just someone to talk to, as you'll hear the state talk about with our state crisis plan. And so when you look at the needs, is there even a psychiatrist even in that county that's in a hospital? Probably not. So like we have a behavioral health urgent care in Rockingham County. We also have one in Richmond County. So those are very rural areas where there aren't a lot of services. And because of that, we see people that come from outside of those counties, not on a large basis, but you will see folks who get referred, hey, you can go here and they will help you. And so you may see somebody, say, that's from Davidson County, go to our behavioral health urgent care in Randolph County, the adjacent county.
Right. One of the barriers is transportation for
Yes,
social
it is.
determinants of health. So that can be an issue as far as being able to provide that service. So again, we appreciate Daymark being in all of these areas. Let's go to one of the issues is with the social determinants of health is where a person lives.
Yes.
From your perspective as a healthcare provider, how do the characteristics of the community where your patients live impact their health?
I think it has a huge impact. Everything from the water quality of the water they're drinking to whether or not there's a bus line. Is there a grocery store that has fresh food? Is there a farmer's market? Is there a cab service? Is there an Uber? So things that we may take for granted, we may not have. So like in Richmond County, there's not an Uber. So how does a person get about if there's no transportation service or if they don't have funds to access those transportation services? And definitely in a crisis, there's not money to or a way to access those services.
Right.
So we try to link individuals to services. We do have some funding from certain counties to help deal with that issue. But our big thing is helping people, if they qualify for Medicaid, help them get enrolled in Medicaid so that they can access at least Medicaid transportation, which is doesn't solve all problems, but it's very helpful.
Right.
And then we're currently also working with the state on crisis transportation as well. Our care managers, through our tailored care management, they can help individuals with transportation, linking individuals to food banks, linking individuals to whatever their need is, helping them link to housing or helping them get in housing that is near places that they can walk to. And so that can help tremendously if you are no longer isolated and out somewhere where there's not services.
You mentioned so many great points. The linkage, I want to go into just a tad. Usually, when we think of linkage, we're thinking of social services, which is a great alternative, which is a great place to start. I remember it 20 years ago, that was the only place you can go to for service. Now we're looking at a MACTA, a Daymark that has several sites accessible to the community, and you can go in there and say, I don't have insurance. How do I go about getting insurance? What was the thought behind, this does address social determinants of health. What was the thought behind establishing a service, a linkage service with Daymark as a part of that, your whole overall service package?
I think for us, it was just pretty much this is something we have to do because years ago we had care management embedded within mental health and then it went away. And now that we have that opportunity, for us, it was something we knew we had to do because of just the nature of the population that we serve.
Right.
And getting people to the right places. We've always in our offices had many food pantries and many clothing closets, where just staff out of, because they saw the need, wanted to, make sure there was some cans of soup there.
Right.
And so those are things that we've always done. So it was just a natural next step for us as an agency to bring that service on board and make sure that we are providing as comprehensive of care as we possibly can. And if we're not addressing the social determinants of health, we can't serve the person. So I've always said, like, if I were not sheltered and it was 2 degrees and it's 2 a.m. and I'm hungry, I'm going to be in crisis too.
Absolutely.
And so how can then I address all of those needs?
Right.
And we just have to do it. You can't address a person's behavioral health needs if you do not address their social determinants.
This is what Chatting with UPOH is all about. We have Michelle Ivy, who is the Chief Program Officer for Daymark Recovery Services. You have to have people, a team who is passionate about what they do, the population that they serve, and being able to have a strategy to be able to implement these services. We thank you so much for listening and tuning in to Chatting with UPOH and sitting and being a part of this candid discussion with Daymark Recovery Services on how to access recovery services and then all the other items that Daymark has to offer. You can reach Daymark on their website,
www.daymarkrecovery.org, and Daymark is spelled Daymark.
Social media.
Also, we are on Instagram, Facebook, LinkedIn, so you can find us at all your regular social media sites.
Thank you much for tuning in, and we look forward to hearing from you. This is Carolyn Mayo, your host for Chatting with UPOH.